get started? Okay, I'd like to introduce my lovely husband. He graduated from Rutgers University with a major in biology and a minor in religion. He attended New Jersey Medical School to earn his MD degree. He did 6 years of general surgery residing at St. Barnabas Medical Center in Livingston, New Jersey. He is board certified in general surgery. He moved to Chapel Hill, North Carolina to do plastic surgery residency for an additional 2 years at the University of North Carolina. He is board certified in plastic surgery. He did an additional year of plastic surgery fellowship at the Mayo Clinic in Scottsdale, Arizona, to gain an additional experience in advanced reconstructive and cosmetic surgery. He went to work in Maui, Hawaii, for 6 months. He moved to Thailand in 2002 and began to work at Olympic Plaza. He is in private practice and sees a wide range of cosmetic and reconstructive patients, including facial trauma. And my lovely husband, Dr. James Motlagh.
Thank you. Can you all hear me? Is this thing working? Daniel, can you guys hear me? No? I think I turned it on. Is it working? Excuse me. Okay. Looks like it's on. They've got me mic'd up 2 ways. So I've got KLTV on my left wrist and ETMC on my right. So, can you all hear me? 1, 2, 3, 4. Is that better? Thank you. All right. How can I go wrong with an introduction like that, right, from my wife? I want to thank you so much for coming tonight, braving the elements, risking life and limb to be here with us. We really appreciate you. We enjoy doing this. It's a lot of fun. It's a lot of work. My awesome staff did a great job of putting this together. They're just fantastic. I think I have the best staff in the business. And thank you to Michael Brosang for the wonderful flower arrangements. I think he's second to none. Thank you to Daniel and the crew for the lovely dinner tonight. They're always something different. And I want to acknowledge KLTV for being here tonight, Gap Broadcasting, and In Magazine. So thank you all for coming. I really appreciate you. And we're going to jump in, have a lot of fun. I'm going to ask you to hold your questions till the end. I'm sure I'm going to stir up a lot of questions. So write them down, hold them, and I'll answer every single one of them, okay? Everybody ready? Yes. Okay, let's go. That's my family, just so you know. We've got the older one, Tyler. He's going to graduate in a few months. This is little boy Lance. This is Justin. My wife Lori. This is Will. This is Spotty. And the one that's missing is this one, the wiener dog, Ava. Recently I had a chance to go to Colorado. This was 2 weeks ago. I love bicycling, so I'm always trying to get better. I went to Carmichael Training Systems. Chris Carmichael is the coach for Lance Armstrong, and he set up this business for about the last 10 years. So I went there to see how he can make me a better athlete. So I'm going to show you a little clip of that if I could. This is called the VO2 max test. They're trying to see what your maximum oxygen uptake and consumption is. It's a very difficult test against resistance on this machine. And it's at 6,000 feet, so it's pretty tough. So you're working your hardest for about 6 or 7 minutes, and before that there's another test. So it's a lot of work. So that's what I do for fun. I get tortured by people. Yes, can I please have another? So, anyway. And what's a trip to Colorado without a visit to Mork and Mindy's house in Boulder, right? All right? Okay, nanu, right? Okay. All right, we're going to jump into the subject. It's called Look Good, Feel Great, right? It's pretty straightforward. When you look good, you feel great, right? Call it the halo effect, okay? When you look good, you feel great. Feel like you have a halo around them. And in general, this is generality. It doesn't apply to everyone, but in general, they find that attractive people are more confident, more popular, more successful, and oftentimes happier. This is not always true, but it's probably mostly true, okay? So this is kind of what we're going to talk about today. She's happy. She's popular. She's successful. Cindy Crawford, right? Okay, Vivica Fox. Okay, she's a fox also, right? Popular, successful, all these things, right? So we've got eye candy on the left and eyesore on the right. Bless her heart, right? Okay, so, you know, the bottom line is beauty matters, especially in the society in which we live in. Beauty matters. You know, whether you want to accept it or not, it matters. This is the aging process. We're all going through it. Every one of us is going through this process, whether it's on the facial level, the boob level, the abdomen level, the butt level, the leg level. We're all going through this. So it's that process. And how do we equalize that? How do we make that better? How do we make it more rejuvenated? That's what we're going to talk about tonight, okay? What are some of the telltale signs of aging, right? Well, excess fat. We tend to eat a lot as we get older. Not enough fat in the face if you get real skinny. Like me, I bicycle so much, my face is skinny. Loose or excess skin, different parts of the body, breasts, arms. Definitely wrinkles or irregular contours or sharp angles. You know, these are telltale signs of aging. What are some basic anti-aging hints? Well, pick your parents well. That's probably the number one thing. Genetics plays a big part, you know. It determines at least 50% of who you are and what you're going to be. Unfortunately, it's out of our control. So try to eat natural foods. You know, Jack LaLanne said, if man made it, don't eat it. Right? He said, if it tastes good, spit it out. Okay? So all of these things are good. Anything that comes from the ground is good. If God made it, it's good. Eat little as possible. You know, we didn't have a lot of food back there, right? You know, we got just little things. But try to eat little if you can. The human body's not made to eat a lot of food. We're very, very efficient. Our metabolism is extremely efficient. And it's when we get into Western societies that we find out, hey, wow, we can really balloon up to 400 pounds if we're not careful. Drink lots of water, sure. Eat antioxidants. I like acai berry. That's my drug of choice. That seems to be good. But vitamin A, C, E, all of these things, glutathione, you know, whatever turns you on is all good. Get plenty of sleep. This is one of the few things that we ignore because we don't think it's important. You know, we just, okay, I can get by on 4 hours of sleep and no problem. But this is key. This is key to repairing everything in your body. We need a reparative period. You know, it's like any athlete will tell you, when you lift weights, hey, thanks for coming. When you lift weights, you got to recover afterwards. You can't lift weights every single day and get away with it. It just won't work. So it's the same process with sleep. Some more, avoid sun damage to the skin. If you want leathery skin, nasty skin, stay in the sun. It's good. Don't smoke. Smoking is an oxidizer. We talk about antioxidants. You know, smoking is a powerful oxidizer. It will destroy you inside out. Control your blood pressure, sure. Minimize your stress. That helps the blood pressure. And stay active. Don't sit around, do things. Go with family, get outside, get some exercise, get the blood pumping. All these are basics that most of you know. Okay, so what's the difference in these two? One is young, one is old, right? So what's the difference? This side's more full, elevated, and smooth contours. This one kind of looks deflated, like the air has been taken out of a balloon. You know, it's descended, it's come down. There's irregular contours, right? We'll talk about some more. Nowadays, nobody's got time, right? I'm on a time crunch. I got to do something. I can't wait. I have no downtime, right? So everybody's in a hurry. So what do you do? So how can you do this if you're time crunched? And we're all time crunched by definition, right? Well, one of the easiest things you can do is get on a good skincare line. Doesn't matter what it is, just get on a good skincare line.